Hello, my name is Tam Stewart. I am a student at the University of Arizona Global Campus working on my master's degree in psychology. Today, I would like to talk to you about my research design for implementing exposure therapy to treat phobias. Exposure therapy is a type of behaviorism that has been implemented to assist patients with phobias or PTSD to lessen or overcome the symptoms associated with the aforementioned mental health disorders. Exposure therapy has many different variations in which subjects are exposed to either their fears or their triggers to help them sit with their emotions and understand them, as well as to help them manage feeling those difficult emotions. Exposure therapy works by exposing patients at varying ranges to their triggers or fears in a controlled environment. This can look like sitting with a therapist and imagining their triggers and or fears, or actually exposing patients to their triggers and or fears. Some believe this is impactful because patients can identify and talk their way through their difficult emotions, as well as helping patients to identify if their reactions to their fears are logical. Social problems seem to play Social phobias seem to plague more and more people in present time. The results of these social issues have made it hard for some patients to function at work and in society, possibly even causing failure. Without relief from social phobias, some patients may lose their livelihoods and become ostracized. For my research design, my question is, how do patients who have used exposure therapy for social phobias feel about the effectiveness of their treatment? The question is important because answering the question will help give an understanding for therapists who are helping those with phobias to teach tools that may help them to remain functioning when they otherwise would be left crippled with fear. The research design that I am proposing will be a qualitative research design. I would like to make this a qualitative research design because I would like to take a deeper look at how exposure therapy impacts patients and the experiences that they have with exposure therapy. The importance of understanding exposure therapy is that it might be beneficial in understanding the effectiveness of behaviorism, as well as finding practical ways to assist patients with phobias to manage or even overcome their extreme phobias. This can help those with crippling fear remain functional even when forced to face their fears. One article that was reviewed during the composure of this research design was Sleep Enhances Exposure Therapy, written by Klein, Willem, Temp, Margraf, Wiederhold, and Rash. Klein et al.'s research examines how sleep after exposure therapy impacts the outcome for those with fears, specifically those with arachnophobia. This article showed how quantitative research design can be used to examine and measure the effectiveness of exposure therapy. This article also attempts to recognize the impact that exposure might have on those with arachnophobia and if sleep has the power to impact that outcome. Contributions that this research would make to the proposed research design would be to take note of the impact that sleep after exposure therapy had on its subjects and to be aware of that impact while working with subjects in the proposed research. Another article that was reviewed during the composure of this research design was investigating the efficacy and experiences with the narrative exposure therapy in severe mentally ill patients with comorbid post traumatic stress disorder receiving flexible assertive community treatment, a mixed method study. Written by Moritz Goossens, Jundik, Vermeulen, and Van Gaal. In this article, Moritz et al. Used a mixed methods approach to determine the impact that narrative exposure therapy, or NET, has on patients with severe mental illness. The research was conducted with objectives to understand patient experiences throughout NET treatment from before the start to the finish and discover what influences the results of narrative exposure therapy, excuse me. The research conducted was both qualitative and quantitative and used both open-ended questions and semi-structured interviews. The results of the study found that narrative exposure therapy could be effective in patients with severe mental illness. This article has been beneficial in composing the proposed research design by providing a model of a mixed methods research design, as well as providing support that some types of exposure therapy have been proven to be beneficial. The aim of this study is to explore how patients who have used exposure therapy for social phobias feel about the outcome of their treatment. A qualitative study will be used to conduct the inductive research. To conduct this study, researchers will conduct in depth interviews with volunteers who have utilized exposure therapy. The questions in these interviews will be open ended to encourage subjects to freely discuss how exposure therapy has impacted their phobias. As the purpose of the study is to understand, constructivism is the paradigm that will be implemented throughout the study. Recruiting for the study will seek out 10 to 15 volunteers with phobias who have participated in exposure therapy. Questions will seek to understand how severely the subject's phobias impacted their life before exposure therapy. They will also seek to understand how exposure therapy impacted the subjects during them. And finally, questions will seek to understand how the volunteers' phobias are impacting their lives after exposure therapy. The results of the study will be able to be applied in a clinical practice by providing statements that support the use of exposure therapy for treatment of social phobias. The focus on this research is to better understand behaviorism, specifically exposure therapy, phobias, and the associations that they have with one another. This research design aims to find a deeper understanding of how phobias can be aided by exposure therapy and and therefore behaviorism. There are many ethical issues laid out in the American Psychological Association's ethical principles. Considerations that should be taken for this research model would be to first gain institution approval as per section 8.01. After gaining approval from the institution, it is important to gain informed consent from volunteers to involve participants and also informed consent to record participants. This also includes informing participants that they may choose to leave the study at any time with no negative consequences. Finally, it is important to debrief participants after the study is concluded. Sometimes patients have phobias that severely impact and sometimes hinder their way of life. While in some instances exposure therapy has come to criticism, narrative exposure therapy has proven to be beneficial to some patients. The hope of this research design is to find more methods of exposure therapy to help patients with extreme phobias learn methods for handling those phobias and to be able to live their lives unimpeded. Thank you for your attention today. For more information, please see the publications listed here. This has been a Caffeinated Piggy production.